Last year, a woman my age collapsed at her breakfast table because of something she drank 2 days earlier. Not alcohol, not spoiled food, grapefruit juice. And what shocked me most? She was taking her blood pressure medication exactly as prescribed, every morning, never missed a dose, did everything right, except for one thing she didn't even know was wrong. Today I'm going to share 5 timing mistakes that can quietly make your blood pressure medication work worse or hit harder than it's supposed to. In fact, if you're over 60 and taking blood pressure medication, there's a very good chance you're making at least one of these mistakes today. This video is for general information only and is not a substitute for professional medical advice. Always talk to your doctor before making any changes to your medication routine. Let's start with number 1, and I'll warn you, this one stings a little. Mistake 1, coffee and your morning pill. I am a coffee woman, have been since I was 19 years old. First thing in the morning before I even open the curtains, coffee. So when I learned what coffee can do to certain blood pressure medications, I sat with it for a minute because I didn't want it to be true. Here's the thing. If you're on a beta blocker, that's medications like metoprolol or atenolol, caffeine can work against it for some people. Your beta blocker is trying to calm your heart down, slow the pressure, ease the load. And caffeine is in there doing the opposite, pushing the gas pedal. It doesn't affect everyone the same way, but for some people, especially those who've had any history of irregular heartbeat, taking that pill and drinking coffee within the same half-hour window can cause the heart to flutter in ways it shouldn't. What did I do? I just moved my pill to 7 in the morning and held my coffee until 10 to 8, 50 minutes apart. That's it. That's the whole fix. If you're on a beta blocker, many doctors suggest giving yourself at least 30 to 45 minutes between your pill and your first cup. But ask your pharmacist because every medication and every person is a little different. And drink a full glass of water when you take it. Not a sip, a glass. Mistake 2, the fruit that stays in your system for 3 days, grapefruit. And this is the story I started with, because I need you to understand this isn't a minor warning on a label. This is real, and it catches people completely off guard. Grapefruit and grapefruit juice contain something that shuts down a specific enzyme in your digestive system, an enzyme responsible for breaking down certain blood pressure medications. Specifically calcium channel blockers, things like amlodipine, felodipine, nifedipine. And that enzyme can stay affected for up to 3 days after you consume grapefruit. So if you had grapefruit juice on Tuesday and you're taking your amlodipine on Thursday, depending on the medication and how much grapefruit you consumed, your body may be absorbing significantly more than the intended dose, sometimes far more, which causes your blood pressure to drop hard and fast. That woman I mentioned at the beginning, 72 years old, 2 years on amlodipine without a single problem. Her husband started buying a new citrus juice blend. She didn't read the label closely. 3 mornings later, she stood up from the breakfast table and went straight down. The juice had grapefruit in it. That was the whole story. If you take any calcium channel blocker, ask your pharmacist directly, does grapefruit affect my specific medication? Don't assume. Ask. Switch to orange juice, apple juice, or just plain water. Your heart will thank you. Mistake 3. When you take your water pill. This one doesn't sound dangerous at first. It sounds like an inconvenience. Waking up at 2 in the morning to use the bathroom. Getting up again at 4. But for anyone over 70, getting out of bed in the dark When your blood pressure shifts the moment you stand up, that's not an inconvenience. That's how hip fractures happen. And hip fractures in older adults are far more serious than most people realize. Diuretics, water pills like hydrochlorothiazide or furosemide, work by telling your kidneys to push out more fluid. That's how they bring blood pressure down. But if you take that pill in the late afternoon or with dinner, it hits its peak effect right in the middle of the night. There's a condition called orthostatic hypotension, where your blood pressure drops suddenly when you stand up. It's very common after 70, and it's much more likely to hit you when you're half asleep at 2 in the morning than when you're up and moving around at noon. I had a neighbor. She'd been waking up 3 times a night for over a year. Exhausted, frustrated. Her doctor finally looked at when she was taking her water pill, 6:30 in the evening. With dinner, they moved it to 8 in the morning. 1 week later, she was sleeping through the night. She told me it felt like getting her life back. For most people, taking a diuretic before 10 in the morning works best. But check with your doctor first, because some people have specific reasons for a different schedule. And if you take it twice a day, ask your doctor about the right timing for that second dose, too. Pair it with a banana or some plain yogurt. Diuretics can pull potassium out of your system over time, and your heart needs that mineral to keep its rhythm steady. Mistake 4, doubling up after a missed dose. Nearly everyone I've ever talked to has done this at least once. You forget your morning pill. You remember at 2 in the afternoon, and you think, well, I'll just take 2 tonight to make up for it. Please don't. For some medications, doubling up is relatively low risk. For others, especially calcium channel blockers and certain ARBs, like valsartan or losartan, taking 2 doses at once can cause your blood pressure to drop suddenly and steeply. In a younger person, the body usually catches itself. In someone over 65, that kind of drop can cause fainting, or worse, not enough blood reaching the heart or brain. Here's the simple rule. If you miss a dose and you remember it later that same day, take it as soon as you think of it, unless your next scheduled dose is less than 4 hours away. If it's close to that next dose time, just skip the missed one and carry on with your normal schedule. Never double up without calling your pharmacist first. The right answer depends on exactly which medication you're on. And if forgetting is a regular problem, set a phone alarm with your medication name on it. Link it to something you already do every morning without thinking. Brushing your teeth, making your coffee. Your body's already in that routine. Let the medication ride along with it. Mistake 5, taking your medication at the wrong time of day. My brother-in-law did everything right, took his medication every single morning for 15 years, never missed a dose, ate well, walked every day, did everything his doctor told him. Then one morning he woke up dizzy and nearly fainted getting out of bed. His doctor looked at his blood pressure readings, not just the numbers from the office visits, but a full picture of what was happening overnight, and asked a question nobody had ever asked him before. Why are you taking it in the morning? Here's what that doctor explained. Your blood pressure is not the same number all day long. While you sleep, it drops. Then in the early morning hours, somewhere between 4 and 10 a.m., it surges back up sharply. And that morning surge is the most dangerous window of the entire day for your heart. Here's the problem with a morning dose. By the time your pill absorbs and gets to work, that surge is already winding down. And by 4 the next morning, when the next surge is building, your medication has been losing strength for many hours. You need the most protection right when your medication is at its weakest. For many people, a bedtime dose may work better. Take it at 10 at night, and by 4 in the morning, it may be near full strength, right when your arteries need that protection most. A large European study followed thousands of patients over 6 years and found that the bedtime group had significantly lower rates of heart attack, stroke, and cardiovascular death. The difference surprised even the researchers. Now, not every study has found the same results. The science isn't fully settled, but bedtime dosing has not been shown to cause harm. And for many people, it may offer real benefit. The only way to know if you're one of those people is to ask your doctor for a 24-hour ambulatory blood pressure monitor. It shows what your blood pressure actually does while you sleep, not just at your Tuesday afternoon appointment. At your next visit, ask 2 questions. Should I be taking my medication at bedtime? And would an ambulatory monitor help us decide? My brother-in-law switched to bedtime dosing 3 months later. The morning dizziness stopped completely. He told me he wished someone had asked that question 15 years earlier. I want to say something to you before we wrap up. I'm not a doctor. I never claimed to be. I'm a grandma who got curious, started reading, and couldn't stop. Please don't change your medication timing or routine without talking to your doctor or pharmacist first. What works for one person may not be right for another. Every body is different. Every medication is different. Your doctor knows your history in a way I never could. But most of us are just doing what we were told, without ever being told why, without ever being told when, without ever being told what not to take it with. You deserve better than that. Your heart works every second of every day. It deserves to be protected every second of every day. If this helped you, share it with someone you love. It might be the most important thing they see this week. And if you're new here, subscribe and hit that bell. Every week I share the kind of information that should come up in your doctor's appointment, but usually doesn't. Now tell me in the comments, how many of these 5 mistakes have you been making? Be honest. I've made at least 2 myself. I read every single comment, every one. Take care of yourself, sweetheart. You really do matter. And I'll see you in next one.